Have you ever wondered what's really going on inside that big, noisy tube during an MRI scan? It might seem like something straight out of science fiction, but the principle behind it is actually incredibly elegant. And believe it or not, it's all connected to something you're made of right now. So let's pull back the curtain and demystify one of modern medicine's most powerful tools.
That's right, the fact that you're mostly water isn't just a fun piece of trivia, it's the absolute key that lets us see inside the human body with breathtaking clarity. This simple biological fact is the foundation for the technological superpower we call MRI.
So, to understand this, we need to meet the main characters in our story, the hydrogen protons. You've got trillions of them. Inside every single water molecule in your body, these little particles are basically acting like microscopic magnets. And trust me, they're about to become the stars of the show.
Okay, so how do we get these tiny little magnets to actually tell us a story about your body? Well, we basically orchestrate a carefully choreographed performance with all of them at once. This is where the real magic begins.
It seems complicated, I know, but it really boils down to 4 key steps. First, the MRI's giant magnet acts like a drill sergeant, yelling at all those little proton magnets to line up in the exact same direction. Then, a quick pulse of radio waves, totally harmless, comes in and knocks them all sideways. And here's the crucial part. When that pulse stops, the protons snap right back into alignment, and as they do, they release a tiny little signal of energy. The machine is designed to listen for millions of these signals, and a super powerful computer translates all that noise into the incredibly detailed images we see.
So what really makes MRI a game changer? Well, unlike X-rays or CT scans, it uses absolutely zero ionizing radiation. We're just talking about magnets and radio waves here. This makes it an exceptionally safe way to look inside the body, especially for patients who might need scans over and over again. It's a huge deal.
Now here's something cool. An MRI isn't just one type of picture. You could think of the machine as a super advanced camera that has all these different lenses. By changing the timing and sequence of those radio pulses, doctors can highlight different types of tissue. They can essentially choose the perfect lens to find exactly what they're looking for.
So these are the main lenses a doctor gets to use. A T1 image, that's like the perfect roadmap for basic anatomy. But if they suspect there's swelling or inflammation, they'll switch over to a T2 sequence, where fluid shows up as bright white. FLAIR, that's a special tool to see brain lesions way more clearly. And DWI is absolutely crucial for spotting a stroke just minutes after it happens. Each one tells a different, vital part of the story.
To put it really simply, just think of the 2 most common ones like this. T1 is your anatomy map. It gives you a super clear structural view. But T2, that's the fluid detector. Any area with extra fluid, whether it's from an injury or an infection, it just lights up like a beacon. By comparing these 2 views, radiologists can pinpoint exactly what's wrong and where.
But just having these powerful lenses is only half the battle. Getting that perfect image is not automatic. It's really an art form that requires meticulous planning and a ton of attention to detail.
This is all the behind-the-scenes work that makes all the difference. The patient has to be positioned perfectly. The technologist has to select a very specific protocol. It's like a unique recipe of sequences for a knee versus a brain. And probably most importantly, the patient has to stay completely still. And why is that? Because even the slightest little movement can create a blur that could hide a really critical diagnosis.
It really all comes down to this. Every single step in that checklist exists for one reason: to give the radiologist the clearest possible picture. Better planning means clearer images, and that leads directly to a faster, more confident diagnosis, and that gets the patient the right treatment sooner.
Of course, with all this power comes a huge responsibility for safety. That magnet is unbelievably strong. And here's the thing to remember. It is always on. That's why the rules about metal are so strict. Anything from a paperclip to an oxygen tank can literally become a dangerous projectile. It's also why patients with certain implants, like pacemakers, have to be screened so carefully. Safety is, without a doubt, the #1 priority.
So after all the physics and the planning and the safety checks, what do we get? Well, we get something truly remarkable: a detailed, non-invasive map of the human body.
This technology has just completely revolutionized medicine. In neurology, it can spot a brain tumor or the telltale signs of MS. For an athlete, it gives a definitive look at a torn ligament in their knee. It even lets doctors watch the heartbeat in real time, and it's an absolutely essential tool for finding and fighting cancer all over the body.
It's just amazing, right? This technology, born from a simple understanding of water and magnets, has given us this unprecedented window into ourselves. It really makes you wonder, doesn't it?
As these maps of our own bodies get even more detailed, and as we learn to read them even better, what incredible discoveries are just waiting for us around the corner?